Hi, Dr. Saxena here, welcoming on behalf of Center for Progressive Medicine. And here we are working out on providing new possibilities in the field of wellness. And this is something to do with we are probably trying to do prevention as well as reversal of disease. I strongly feel this is a big domain, and we are here. I'm what we are just trying to make you explain is we need to do reversal as well as prevention of the disease, and somewhere in the broader context, we try to cover some of the issues involved and how we can best overcome that kind of issues and all that. And talking about what we are working on here is more probably most we are working on most 99% of cases we work on a chronic medical disorder. Chronic medical disorders, namely diabetes, obesity, heart disease, cancer, arthritis, and here all of these issues we are working out on formulating. We have formulated a lot of protocols for that, and we have some non-surgical solutions in the pipeline as such. And what you can expect from us. I am expert in autism. I've done a lot of work on related to autism things as such, and we were able to work on a thing called biomedical intervention as well as hyperbaric oxygen, which is the only kind of center providing in the whole India here this particular thing. Apart from the other things, we are trying to work on some areas related to developing of some molecules, basically trying to work out on some pharmaceuticals. I can't say this is the pharmaceuticals because these are not classified as the drugs. It's the most, it's something like dietary supplements. Yes, I'm talking about something like magnesium, which is a universal now. The people are deficient in magnesium. We have developed a transdermal kind of solution for magnesium and all. And apart from that, we try to work with a lot of detoxification. What I have been trained into a thing called pollution related problems as such, and now we are very strong in the sense we are now able to show that this is the pollution which is slowly eating us, all of us as such. Take any case of chronic medical disorder, whether it's a diabetes or a cancer or a heart disease. The essence of the situation thing is the bottom line is where you have a oxidative stress and you have got a degeneration asset. With this oxidative stress is being fueled by a lot of free radicals which are present in our body. I want to emphasize here these free radicals which are there in our body we used to think about people who are having smokers and all that. We used to think it's them who are having this free radical pathology, but in the day-to-day terms, in the present situation, now we see all of us, though we are not we don't take any kind of stuffs, we are getting into this free radical pathology. And the treatment is quite simple, wherein we are trying to reduce this kind of process which induces free radical formation. There are some nasty chemicals we are talking about. We are talking about plastics, we are talking about cadmium, mercury, we are talking about lead, we are talking about diesel exhaust, we are talking about the kind of fluoride and all that. All this cocktail which is being thrusted upon us, like it's being we are having a big time trying to deal with all these chemicals as such. So these chemicals, if we are able to reduce this kind of chemicals from our body, which I aptly call it as a swatch there, and if we are able to do that particular thing, and slowly while doing that, if we can oxygenate properly, if we know how to breathe properly, try to see that the oxygen saturation in the body and goes into the remotest corner of the body with ease as such, by doing some simple things like we try to work it out with the hyperbaric oxygen and other some lot of vitamin C protocols and other things, which makes a lot of difference in particularly patients suffering from cancer and other degenerative disorders. Diabetic foot reversal is one thing we are working on that. We have a unit which is diabetic foot care and both prevention and reversal. We are trying to pick up early diabetic ulcer formations. We are trying to work on a scale with thermoscan, and with this thermoscan we are able to pick up the pathology quite earlier, and that is a thing. Thank you.